Tell us a bit about the fact that, see, initially the treatment was under government control, and we know that in India, healthcare is private sector is a huge part of healthcare in India, unlike the West. Um, so, did that put you at a disadvantage that you were not in the fight right from the word go, and you were sort of private sector was brought in subsequently? Did that disrupt anything, or how was that experience?
So I'll correct that impression a bit.
Yeah.
Uh, while you're right that in certain parts of the country the government decided to do it themselves initially and then subsequently brought in the private sector, there were other parts of the country like Mumbai, for example, where from the beginning the government and private sector together worked to make sure that patients were getting treatment options. So I think we had that advantage of being in multiple geographies and therefore being more prepared. I think what this taught us really was, two words come to mind. One is uncertainty and how to deal with that, and second is constant evolution. And we learned what VUCA really means, right? Before this, one had just that was just a term. But when things are ever changing, when you start from a situation where you don't have cases in the country and you hear about all the stuff from abroad, and then constant evolution over many, many days and months, and then you come up with protocols that today perhaps are best in class. If you look at the kind of outcomes that that the country is demonstrating today in terms of being able to manage reasonably large numbers, you kind of forget that most hospitals aren't equipped to handle infectious diseases beyond a handful of numbers. And from there today, to have thousands of patients being treated in our healthcare infrastructure and treated with the best of outcomes is, I think, a huge journey that together with the government, private sector hospitals have sort of walked that path. And I think through that journey, the learnings have been like in any change. You need to be on your feet. You need to have empowered teams at the front end who are watching, monitoring, making the decisions, and then constantly communicating within the cities, learning from each other, and making changes as you go along, not waiting for a perfect answer. So I think that's what we all collectively demonstrated. Sangeeta ji's talked about a lot of this. So just one small example, from zero telemedicine consults, right, in our network, to 20% of our current volumes being on teleconsult and video consult in a matter of 3 months or 4 months is remarkable. Similarly, like I said, from having perhaps not even, we started with just 150 beds devoted to COVID, and that took a lot of our effort to even set up in terms of manpower, treatment protocols, how do we staff it, how do we isolate it, and so on, how do we provide the PPE for it. And today we are at 1,200, and we have the confidence that if required, we can scale up further, right, all the way till the requirement is. So I think that's the beauty of what has been accomplished in the sector, and I feel very proud, along with my colleagues. Dr. Sangeeta ji, of course, is a stalwart of the industry, but everybody's played a very strong role of partnership, and I think the country should be proud of where we are. Of course, don't want to rest on our laurels. This is going to be the new normal, and that's another example. All the way back, 3rd of May, we published the first handbook that says that life will change forever. And what does that mean for us in a hospital? And how do we change each touch point of the hospital in order to adapt? And that booklet is, again, like Sangeeta ji also mentioned, it's not a standalone or or a unchanging booklet. It's having to be revised as we go along. So I'm fairly confident that we will weather this together, and we come out of this stronger and with more resilience for the future in situations like this.